Good evening. You're watching The Big Story with Haryanto Daman. I'm Olivia Quay. If you're watching us on YouTube, please subscribe to the Straits Times channel so you never miss a show.
The Health Ministry confirmed 451 new COVID-19 cases today. 7 of these are community cases, including 3 Singaporeans or permanent residents. Migrant workers living in dormitories make up the other cases.
Moving on, Singapore will start human clinical trials next week for a potential COVID-19 treatment. The treatment uses an antibody that targets the SARS-CoV-2 virus to slow down the progression of COVID-19 and speed up recovery. 23 healthy individuals will take part in phase 1 of the trial, which will last 6 weeks.
Meanwhile, the antiviral drug remdesivir has been approved to treat seriously ill COVID-19 patients in Singapore. These include those with low oxygen saturation levels and those who need more intensive breathing support. So far, remdesivir is the only treatment shown to benefit COVID-19 patients in a robust clinical trial.
58 fines were issued in the first week of reopening to businesses and individuals following inspections of workplaces, malls and tourist establishments. In particular, 5 businesses were fined $1,000 each for not enforcing proper safe management measures like having employees work from home when possible. Another 53 individuals at retail and F&B outlets were fined $300 each for infringements such as not wearing masks and leaving home for non-essential reasons.
A doctor who was found guilty of sexual assault in February last year has had his conviction overturned by the Court of Appeal. He has also been cleared of all charges. Dr. Wee Tiong Bu was originally accused of raping and molesting a 23-year-old patient on separate occasions in 2015. He was cleared of the rape allegations last year after the High Court accepted medical evidence that he suffered from erectile dysfunction. But a judge convicted him of sexual assault and Dr. Wee was sentenced to 10 years jail. The Apex Court today, however, fully acquitted the doctor, saying that they were troubled by the many aspects of the patient's account.
Separately, a woman who allegedly pulled down her mask and spat at a KFC employee was charged in court today. Lin Se Ting was charged with intentional harassment, use of criminal force, and breaching safe distancing measures. Lin had also hurled verbal abuse at the employee. The accused first made headlines when a video of the incident surfaced online.
Testing and early detection have always been a key part of Singapore's fight against COVID-19. And as Singapore steps up its COVID-19 testing efforts, close to 200 clinics are now equipped to perform such tests. Right now, only targeted groups get tested, including staff and residents of senior homes, preschool staff, as well as seniors, healthcare workers and older students diagnosed with acute respiratory infection by their GPs.
Moving forward, testing will also be expanded to cover workers with higher risk of exposure to the virus, such as frontline workers supporting COVID-19 operations. Singapore is to ramp up its fight to eradicate COVID-19 by increasing the number of people tested per day from 13,000 to 40,000. To reach that goal, 4 regional screening centres are now operational.
They're at the Old Police Academy, the Float at Marina Bay, Bukit Gombak Sport Hall and Bishan Sport Hall. A 5th centre at the former Sepak Takraw Sport Hall on Bedok North Street 2 is in the pipeline.
These centres support screening requirements for workers in identified sectors such as construction. The centres conduct polymerase chain reaction tests and do not take in walk-in requests for screening.
Other swabbing sites have also been set up in collaboration with private partners to support these efforts, such as the drive-through testing facility at One Farrer Hotel.
Let's get insight from Dr. Hannah Clapham. She's an epidemiologist and mathematical modeler at the Swee Hock School of Public Health at the National University of Singapore. Welcome back. So, Dr. Clapham, it's been said several times before, and National Development Minister Lawrence Wong said it again yesterday, that Singapore will be able to conduct up to 40,000 tests a day. Will that bring a change in testing strategy, though? Currently, we're doing about 13,000 tests a day, and they're still only targeted at certain groups.
Yeah, so the ramp up of testing is absolutely vital in the response, and moving up to 40,000 tests a day will be great. As we know, Singapore population is 5 million, so we're still quite a long way from the full population. Of course, that's not what we would expect to have happening here. But with 40,000 tests, we're still going to be in a targeted strategy, but of course we'll be able to do more tests. So what we'll see moving forward, I would think, is that we'll see as more sections are opening up, those will be the sections that we will start to see targeting. We saw that with the first lot of schools that were opened up, we saw testing targeted there, and then we'll see in the different levels of schools opening up testing targeting there and moving forward. One of the really important things that I think in testing that will be coming in and will ramp up is going to be testing of people not in those targeted populations, but people with mild symptoms. And I think getting at these parts of the population and these individuals and their role in transmission so that we're able to contact trace from those people is going to be really important. And that's part of the plan. That will the testing of people with mild symptoms will be slowly ramping up in different groups, and I'm looking forward to that.
Some people have asked, Doctor, if everyone should be tested so that we could pick up all the asymptomatic cases. Would that work?
Yeah, so this is a strategy that has been tried. I think we know that in Wuhan this was done recently. So again, with 40,000 tests a day, it would take a long time to get through the Singaporean population. So at the moment, a targeted strategy is the best way forward. I think even if we could do the whole population in a short space of time, it would sort of depend how long that could take. We would have to think carefully about whether that was the optimal strategy, or whether it would be better to maintain targeting on the important populations. And the targeting there is important because we're looking at individuals that are either going to be in situations where they could be spreading to people. So that's why we're testing people that are heading back to work and those kind of things. And also groups that might be spreading to lots of people. So that's an important part. The other part is, of course, people that might be spreading to, or people that are in those high risk groups where we really want to pick up infections early so that we're able to ensure that there is not large amounts of spread through to, people, the elderly and people at higher risk of severe disease.
Well, more testing will, of course, reveal more infections. And ever since we exited the circuit breaker, the number of community infections has gone up, both linked and unlinked cases. Do you see anything in the figures that could derail us from going into phase 2 at the end of this month?
Yeah, this is the million dollar question. So as you say, there's more testing going on, so we're finding more cases. Before, an important strategy or sort of metric that was being used was the ratio of linked to unlinked cases, but that's also going to be changing as we're changing the way that we're finding people to test or targeting those testing. So it's going to be a ongoing thing, and I think just one day's testing isn't going to give us that picture. It's sort of looking at what's happening over a week, bearing in mind the tests that are being done and the number of tests that are being found. Number of positive tests that are being found, of course. And it's not just the number of tests, as we've said, it's where those tests are being done. So unfortunately, lots of things to think about, and I know that the task force is looking at these numbers very carefully and keeping track of what they mean for transmission.
Right. Dr. Clapham, I just want to veer to another issue right here. A survey by the Deep Knowledge Group has said that Singapore is the 4th safest place to live in during the pandemic. That's ahead of countries like New Zealand, Taiwan and Vietnam, who have been lauded in their battle against COVID-19. Do you agree with the survey? I mean, after all, New Zealand has removed all its internal measures.
Yeah, so I was really interested to see this survey this morning, and I had a look through the methods that they're using in the survey, and it's an interesting mix of sort of lots of different things that are going into the response and the current situation in the country. So I think the top 20 seems really to me to encapsulate the countries that are doing well in the response. Of course, there are others further down the list as well. And what we have to remember when we're comparing countries is that every country is in a slightly different situation in terms of when the epidemic started, what the population is in their country, the demographics, all those kind of things. So within that top 20, we're seeing a group of countries, as you say, some that are now at very low, if not no cases reported in their countries, and others that have more cases, but they're all including countries that have a really good response and are really also reacting very quickly and well to what is going on within their country. So an interesting metric, and one that we'll keep an eye on, I think, in the coming weeks and months, and it will be interesting to see what happens.
Right. Well, thank you so much, Dr. Clapham. Good to have you on the show again. We've been speaking to Dr. Hannah Clapham from the Swee Hock School of Public Health at NUS.
We have the answers to the most asked questions about COVID-19 testing later in the show, so stay tuned to askST. For now, though, it's time for a quick look at the global headlines with Dylan Ang.
Thanks, guys. Malaysia Prime Minister Muhyiddin Yassin announced the resumption of domestic travel and small-scale social activities as part of the Recovery Movement Control Order. The new phase will begin today. While international borders remain shut, the new rules will also see the reopening of schools in phases and the resumption of non-contact sports. Police say they are bracing for a surge in traffic as thousands of Malaysians are expected to make long-awaited trips. Elsewhere, South Asia coronavirus cases have increased at the fastest rate globally in the past week. According to data compiled by Bloomberg, infections have risen by 27% in Pakistan, 19% in Bangladesh, and 17% in India. The news comes as cases fall in Europe and the United States. In football, Premier League club Manchester United's friendly against Stoke City was cancelled at the last minute after Stoke's manager Michael O'Neill tested positive for Covid-19. Stoke had arrived at United's training ground when they were informed of his positive test. He had tested negative in the previous 5 rounds of testing. The news comes as Premier League clubs prepare for the season's restart on June 17. And those are the global updates. Back to you guys.
Moving stateside, the US is into a third week of daily protests in the aftermath of the death of George Floyd. This, plus the COVID-19 crisis and a dwindling economy, means pressure is mounting on President Donald Trump.
With the presidential election less than 5 months away and a second term in his sights, Mr. Trump has unsurprisingly upped his rhetoric against China. And so, as the tussle between the two nations escalates, what ramifications will this have on America's relationship with the world, and particularly Southeast Asia?
Well, those were on the agenda on the latest episode of Asian Insider. Now, US Bureau Chief Namal Ghosh quizzes Ian Bremmer, president and founder of Eurasia Group and G0 Media.
China's become such a huge issue. It sort of replaced Mexico in 2016. The relationship is in a slide on almost every front, and Hong Kong is potentially turning into a proxy conflict zone. We have increasingly negative public sentiment on China here in the US, according to the polls I've seen. What should we brace for in terms of the US-China relationship?
Well, the US-China relationship is heading towards a Cold War. I wouldn't make the prediction that we'll be there at this point, but certainly on pretty much every front, from Hong Kong and Taiwan to the South China Sea, to technology, to trade, to the coronavirus. On all of these issues, we're seeing that actually confrontation between the world's 2 largest economies is actually becoming significantly greater. And Trump does understand that blaming the Chinese government for the original sin of coronavirus, which of course they did cover up, they didn't share the early results that they had from their labs with the World Health Organization or with the rest of the world. That's something that actually has bipartisan support in the United States. If he didn't have a tough line policy against China, frankly, Biden would beat up on him in the elections for that. So, I mean, pretty much everyone is rowing in the same direction. Now, Trump does understand that hitting the Chinese directly on the Phase 1 trade deal would mean more tariffs on consumer goods. that would hurt the American economy, hurt the markets, hurt the American consumer. And he's been reluctant to do that. But on every other front, he's hitting the Chinese very hard. And as we get closer to the election, especially if Trump's approval ratings are poor, I think even on the phase one deal, he'd be more likely to break it because, of course, then there's not so much more economics to fall before the election, but you are benefiting from really being the guy that's tough on China. And Trump sees very clearly that that's where he wants to position himself. Let's also keep in mind that the Chinese government, Xi Jinping, is not guaranteed a third term in 2022. And quietly, senior leaders in China are saying that Xi Jinping has made a lot of mistakes, and maybe he shouldn't be leader for life in China. Maybe term limits shouldn't be a thing of the past. And so I think Xi Jinping's willingness to also play nationalism against Trump is going to be higher. You've certainly seen that in terms of the willingness to change the rule set for Hong Kong of benefit to Singapore, not good for the Hong Kong people. All of that plays. So I think the timing of all of this for domestic politics for both the U.S. and for China are making this worse.
So tell me one last quick question. This Southeast Asia, ASEAN and Southeast Asia, how important is that in Washington, D.C.? We have the free and open Indo-Pacific, and Southeast Asia is supposed to be in the middle. It is in the middle. How important is it for the U.S. as a relationship with Southeast Asia as a region?
I think it's becoming more important for the reasons I mentioned, more military engagement, Australia particularly important as Hong Kong goes away as a global financial center. Singapore will be where a lot more American financial institutions and corporations have their Asian headquarters. So Singapore will become more strategically important to the United States, and that will be problematic for Singapore because, of course, it'll be harder for your country to balance between the U.S. and China and having sort of open, friendly relationship with everyone no matter what. But I do think Southeast Asia is going to become more strategically important. That's the gravity of the global economic growth is increasingly going to be in your part of the world. And I think that America's international and national security interests will align with that. That is a double-edged sword, assuredly.
You can catch the full episode of Asian Insider America in Crisis on the Straits Times YouTube channel. The link is also in the description below. Let's go back to Dylan for Also in the News.
Hong Kong police arrested 53 people yesterday as it marked the anniversary of pro-democracy protests. Hundreds of activists took to the streets before police fired pepper spray to disperse crowds. Despite a ban on gatherings of more than 8 people to prevent the spread of the coronavirus, more protests are planned in the coming days. China has cautioned students considering studying in Australia during the pandemic. This is due to racial incidents targeting Asians. China's Ministry of Education warned students on Tuesday, saying there have been multiple discriminatory incidents against Asians in Australia. Chinese students make up the largest overseas group in Australian universities, with more than 500,000 enrolled last year. Australia's Education Minister said the country was a multicultural society that welcomed international visitors, adding that the nation's success at flattening the coronavirus curve meant that Australia is one of the safest countries in the world for international students. And finally, long-running American reality show Cops has been cancelled. Paramount Network removed the show from its schedule due to the ongoing protests in the US calling for police reform. The show's 33rd season was expected to premiere on June 15. Civil rights group Colour of Change began a campaign in 2013 urging for networks to not renew the unscripted show, saying it portrayed a distorted image of Black Americans and the criminal justice system. British comedy Little Britain has also been removed from several streaming services, including Netflix and the BBC, over its use of blackface. The hit show ran from 2003 to 2007, though one of its stars, Matt Lucas, has expressed some regret at the characters portrayed. In a 2017 interview, he said, "I wouldn't make that show now. It would upset people." That was also in the news. I'm Dylan Ang.
Thanks, Dylan. A multilingual AI-powered chatbot is being used to monitor the health of migrant workers who are diagnosed with COVID-19. The idea came from two doctors from the National University Health System, Dr Jen Wei Ying and Dr Stephanie Koh, and was developed in collaboration with AI healthcare startup BotMD.
The chatbot has been named SGDOM-bot and it's available in 5 languages, including Chinese, Tamil and Hindi. Patients in the 6 NUHS's managed dormitories can use the bot to record their health data like temperature and heart rate. NUHS's clinicians will receive an instant alert whenever there are abnormal vital signs reported.
We're now joined by Associate Consultant Dr Jen Wei Ying to share more on SGDOM-bot. Doctor, how did the idea to develop SGDOM-bot come about? And if you could briefly take us through as well how it works.
So initially, when everyone was diagnosed with COVID-19, they were being cared for in hospitals. And when the number of cases in the dormitories surged, it became necessary to isolate many of them within the dormitories in order to avoid overwhelming hospital resources. We could only provide on-site medical cover during office hours. So we wanted to quickly design, iterate, and deploy a clinical tool to help our doctors care for all of these patients off-site. We also had to rapidly take care of the healthcare needs of thousands of dormitory residents. When we first came up with the idea, our priority was to enable the safe healthcare provision to a population which is in desperate need of it. The first few times we tried to deploy a solution, it took a bit of iteration because we needed to choose something which was familiar to the residents. Yeah. After a bit of iteration, we relied on a monitoring platform that worked through WhatsApp because most of them use WhatsApp for regular communication with their families. Downloading a new app was a little bit difficult because they had to go to the App Store, and when you ask them to input app names, unfamiliarity with the English language made it difficult to find those applications. QR codes were also not easy to use because residents didn't instinctively know how to scan them or open them. And so when we got to WhatsApp, actually it was very familiar and very usable, and we were able to teach thousands of residents how to use it very quickly.
Well, that's great to hear. So, Dr. Jen, a two-part question for you. How many patients have started using the app so far? And how effective has it been in monitoring the health of the patients and helping to identify as well those who need medical attention?
So we've had about 1,000 users log their vital signs over 10,000 times, and there have been about 100 teleconsults as a result. I think the development and iteration process has allowed us to have an uptake rate of over 90%, which has enabled safe monitoring and accurate identification of the minority of residents at risk of deterioration. So I think very few went to hospital, less than 20, and the 100 teleconsults that were done also allowed on-site doctors to focus on residents who needed attention the most, while expanding the available manpower to help render care, because a lot of us were able to do it from our homes during the lockdown. It also reduced healthcare worker exposure time and conserved valuable protective equipment. And one of the really important things was that it enabled us to tap on volunteer translators who've really helped transform the care we're able to provide to the migrant workers. I've been in the dorms in the community isolation facilities myself, and the language barrier is really quite difficult. But when we've been teleconsult and looping in translators in a 3-way call, we've been able to really get a lot more detail from the workers and help them a lot better.
Doctor, could you share some anecdotal examples of cases that were alerted via the platform and successfully received prompt treatment as well?
So I'll give you 2 examples. The first was actually a resident who reported through the platform that he was having chest pain. Now, Steph and I were incredibly surprised when we got that alert on a weekend morning because the platform wasn't actually live in the dorm at the moment. So we did a check and we found out it was a real resident. And when the team went to his room, he was actually having a very, very fast heart rate and having ongoing chest pain. And he was then conveyed by emergency ambulance to the hospital. And I think this was a proof of concept for us because, you know, he hadn't been taught how to use the platform. He just found the link from one of his friends who was in a pilot group. And the second example is actually someone who actually just had a teleconsult done today. He had visited the medical post in the dorm 4 times in 3 days. He's a fairly educated guy. I mean, he does his father is a doctor, and he was actually very worried since being diagnosed with COVID and being conveyed to a community isolation facility. And it was very difficult for the on-site medical team to get to the bottom of his complaints because of the language barrier. But after having quite an in-depth discussion with one of our volunteer translators, she was able to get to the bottom of his concerns, and he mentioned he felt a lot better after speaking to her.
Dr. Jen, you mentioned previously that there are many benefits that this chatbot has given to teleconsulting, especially when it comes to overcoming the language barrier. So, are there plans to further develop SG Dormbot to fill in other gaps in telehealth monitoring?
Yeah, for sure. I mean, we hope that COVID is not going to be with us for very much longer. But we've actually planned to develop this solution to scale for different telehealth solutions in the long term. And our monitoring dashboard is actually currently being built on secure servers to plan for this. And we've got ideas for things like diabetes, as well as blood thinning medications, a host of different conditions that we could develop this for.
Well, thank you so much, Doctor, for taking some time to share with us more on this SG Dormbot. And that was Dr. Jen Wei Ying, who led the project to develop SG Dormbot, an AI-powered bot for telehealth monitoring of COVID-19 patients.
Many of you have written to the Straits Times on how COVID-19 testing is done. Mass testing has been conducted at foreign worker dormitories and at some polytechnics for preschool staff, hospitals, and nearly 200 clinics all to perform COVID-19 tests, and 4 regional screening centers have been set up.
So, first question, who can get tested? Well, not everyone yet. Groups that are tested so far include staff and residents of senior homes, preschool workers, migrant workers in foreign worker dormitories, as well as seniors above 65 years old, healthcare workers, staff from educational institutions, and students who are 13 and older, who are diagnosed with acute respiratory infection when they visit the doctor.
Now, these groups usually take a polymerase chain reaction or PCR test. So what can you expect during a PCR test? Well, the swab test is free and will take 3 to 4 minutes. Most laboratories can give the results on the same day. And remember to bring along your ID card, as multiple checks are likely to be conducted to ensure that the test is done on the right person.
Now, last question, how is a PCR test done? Samples are taken from the back of the nose or throat. The back of the nose is often the preferred source, as it has the highest viral load among COVID-19 patients. But a nasal swab will not be conducted if you've recently had any nosebleed, surgery, or injury. A cotton swab will be placed all the way to the back of the nose or down your throat for 2 to 3 seconds each. You may tear or feel slightly uncomfortable, and you should raise your hand if you experience any pain or discomfort.
More detailed answers are in the description below if you're watching us on YouTube. And if you have more questions, send them to askST@sph.com.sg.
Now, for more news and videos, do visit straitstimes.com, and remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story.